Dr. Levy.
Good evening.
I'm glad you're here.
Glad to be here.
Kristen and I had a conversation with Dr. Levy just the other day, and it was a really good one.
It was a great conversation.
We were preparing for this podcast.
Yes, we were.
And I had a sense he was going to be a really good guest.
Thank you.
And I still have that sense.
You know, I'm super excited about it. I think there's a lot of misinformation, and I'm excited to have our listeners learn the truth.
Yeah, listen, it'll be great.
Mm-hmm.
And when you
a lot
say
of misconceptions.
misinformation, you're talking about related to medical marijuana. So we're going to get there. But I want to just, for anybody who didn't hear our initial conversation, we started talking about the fact that many people believe that doctors care only about the money. Right?
A lot of people have that unfortunate misconception.
And another thing is, doctors don't care. Now, I want to tell you something interesting. I did a talk for doctors, and I asked the question. I shared some numbers, and 65% of American adults over the age of 45 have been diagnosed with at least one chronic disease. Mm-hmm. And I listed some of the chronic diseases, and I said, whose fault is it? And they say, the people. And I said, but aren't you guys healers? Like, shouldn't there be some responsibility for the medical field if this is the crisis? And they go, no, the people, because all they want is the drug. Now, this is really interesting because the people say the doctors only care about the money, and the doctors say the people only want the drug.
Right.
The people don't only want the drug. They're hypnotized by their television because they see a commercial with people skipping on a beach with the dog and they spin around in slow motion and then it says, ask your doctor for.
Exactly.
So it's like the whole system is so removed from getting people well that you can't be a doctor in good conscience and not be frustrated. You agree?
Absolutely. This day and age is extremely frustrating practicing medicine. With all the technology that's out there, from social media to WebMD and whatnot, you know, patients Google these sites and
Dr. Google.
Dr. Google, there you go. And they read and they really don't know what they're reading. They don't have, you know, proper education to understand what they're reading. And they come in and I said, oh, I looked on WebMD or whatnot, and this is what I have. And, you know, I think every one of us that's a physician, when you have a patient that comes in like that, we kind of cringe a little bit because now they already have this expectation and they may be completely off track. And now we got to get them back in and say, hey, listen, you don't have this. This is what you really have. So that's kind of difficult. But we're in a society now where there's so much media, be it radio, print, television. Evening time, if you watch any television, practically I would say 70% of all the commercials are for big pharma pushing their drugs.
And it's all accessible in your phone now.
Oh, completely.
I mean, if you're at a red light, you could start looking at your medical condition online.
Without a doubt.
And Kristen, I know this is kind of a peeve of mine, and maybe I'll say ours, is, you know, we meet a lot of people who use this word research. They go, well, I researched it, and I learned that vitamin B is something that they learned from reading something on a website that some company posted with an agenda.
Right.
So I'm old enough to remember going to the library to research.
Of course.
Do you remember like the little microfiche?
The Dewey Decimal System, and you spend all day there,
Yeah.
and it takes hours to find what you're looking for, and now it's just on your phone.
Yeah. So they're not researching, they're reading a website.
Right.
Yeah,
and
one of the things that we talk about, too, is that people sometimes want a quick fix. They've become accustomed to this.
course.
I just want a pill and I want a quick fix, and what can I just take right now and be better?
Right. Well, we live in a society right now where it's instant gratification. Everybody wants instant gratification. Nobody wants to put any effort into anything or work hard for it. You know, in the office when I see patients, oftentimes, for instance, for weight loss, they all come in, oh, could I just have a pill for this? I really don't want to be dieting and exercising.
But there it is. That's the doctor saying people only want the pill.
Right.
But I think the people are misled because they're told by television or media that there is a pill.
Right. Absolutely. And so many times they, I don't want to say invent, but they create these disease or illness states, and they can make a drug, or they take a drug that's been out on the market already and just revamp it or give it another name, and now they tell you, okay, well, this drug is good for this now.
Right. So did like restless leg syndrome exist in the 1930s?
Of course it did, but nobody knew what it was.
There was no name, there was no medication
there was
for
no
it.
nothing, exactly.
I don't even think there was such a thing as pre-diabetes back then.
I don't think so either.
You had it or you didn't.
Exactly.
It wasn't like,
Right.
you're on the way, so let's medicate you.
Exactly.
Yeah. So when we were talking about, this belief that doctors only care about money, we spoke openly and honestly about doctors go to medical school. Why?
Because it's a calling, to be honest with you. Every physician that I've ever met knew they wanted to be a physician for the most part from a very young age. And it's just a calling. I think you're fascinated between, science and the human body. And it just kind of like drives you in that direction. I wanted to be a physician since I was 5.
And then at a certain point, whether it's toward the tail end of medical school or once you actually get into the field, many people get jaded because they're not getting out of it what they anticipated they would when they went to medical school.
Yeah, not so much while you're in medical school. Oftentimes internship, residency, and fellowship really beat you down. It's brutal. It's physically fatiguing and mentally taxing. Listen, I know physicians that have PTSD from their residency and fellowship. So it's grueling. It's taxing.
Yeah, we spoke about the fact that burnout is now, there's a code for burnout, so
Yes,
you can
there is.
prescribe medication. And when I looked at all the studies on it, it heavily is weighed upon doctor burnout.
Yes, it is.
Yeah, so yeah, it's very real.
Yes, we have huge burnout. I mean, anytime you deal with the public, it's difficult. But when you're dealing with the public and it comes to the human body, when it comes to medicine, when it comes to true medical conditions, it makes it that much harder.
If you had to put a percentage of patients that you were, helping or truly getting out of pain or changing their lives when you were practicing traditional medicine versus how you're practicing now, what would kind of be the difference?
Oh, it's a huge difference. So before, when I was practicing conventional medicine, I was writing for benzodiazepines. Back
And
in
for the most listeners,
Sure. Benzodiazepines being Xanax, Valium, Klonopin, those types of drugs. The opiates being OxyContin, Vicodin, Darvocet, Vicodin, etc. So not so much that I was writing for opiates, because that is really now left to anesthesiologists or physicians that are board certified in pain management. But, so many people have insomnia, and a lot of people use the benzos for sleep. But in this country, if I'm not mistaken, it was every 12 minutes, there is a death from an overdose. And most of those overdoses are either from opiates or benzodiazepines. I personally have not written for a controlled substance, be it an opiate or a benzodiazepine, in almost 3 years now.
So let's come back to the question. If you had a
percentage.
Number of patients that you were treating the old way,
Right.
and now you have patients who you're treating, let's say, the new way, and we'll get
Correct.
into what that means.
Right.
Percentage-wise, what were you seeing in terms of people actually getting well?
You know what?
Was that the question?
yes.
It wasn't a question. Well, I'll tell you what. They weren't really getting well. You're just keeping them at a baseline. Unfortunately, you're not curing anything in that respect. You're just keeping them at a baseline. But oftentimes what happens with those medications after a period of time, the body develops tolerance. And now the amount that used to help you, now you need more. And that's oftentimes what happens with opiates and the benzodiazepines. You start on a low dose. Before you know it, that dose doesn't help you anymore. So now you got to start picking it up. And next thing you know, your body's jonesing for more of that drug. And that's how, dependence starts to develop.
And how about now?
Now, what I'm doing now, it's a completely different ballgame. So what I'm doing now is I've been doing medical cannabis recommendations now for about almost a year. And I've seen a tremendous amount of people that used to be on opiates as well as benzodiazepines. I've helped them get off of them simply by just using medical cannabis.
What do you see in terms of changes in the patient when they get off of those drugs?
Well, the thing is this. Opiates can make people very, very nasty. Okay, there's something about opiates that just make people mean and
We've
nasty.
met some of those people.
We have.
Yeah, and it's
And
horrible.
unpredictable.
Unpredictable.
With their emotions.
Right, it's horrible. But I'm talking about even patients, for instance, that never take opiates, but they go in for an operation, be it a hip replacement, knee arthroscopy, an appendix, and they're maybe given 3 days of pain meds. Now, with the new laws, you could only, for acute pain, prescribe 12 pills. But before, the surgeons would maybe give you, here's 30 Vicodin or 30 Percocet and whatnot. But studies have shown, and we've seen that after 3 days of opiate use, there starts to be chemical changes in your brain in these individuals that want to start craving the opiates. So somebody that is of normal mind and a very happy individual, and you never see them in change in their mental status or behaviors, all of a sudden these people on opiates transform. And it happens really, really quick.
So do they recover?
Once they get off the opiates, yeah, they come back to full function. Now, that being the case, some of them, again, depending on genetics and personality, they may now develop a real addiction.
I don't want to go down this road because we did an entire show on the topic of addiction.
Gotcha.
But I want to ask you just, can you understand, I know you understand it intellectually, but can you understand addiction emotionally? In other words, if you're taking something by choice,
right,
and it's destroying your life and your family, your relationships and your career. And, you know, I said this to Chris in another show. Isn't the answer just stop? So I said, intellectually, I understand addiction,
right,
but emotionally, I go, why don't they just stop?
It's not that easy. Again, it depends on your genetic makeup and your own mental attitude. And for some individuals, this craving for this drug, for a lot of individuals, is so strong that's why you have so many overdose deaths in this country. And it's really hard to understand. It doesn't affect everybody the same way. Like some people will have surgery and they'll be on opiates for a couple of days and then they stop them and they're off and they're done. On the other hand, you may have a different individual with a completely different genetic makeup, and this individual has never used drugs, never did anything, and next thing you know, they are hooked on opiates.
So you were running, let's say, a conventional family practice. And at some point you grew frustrated and just felt like, I've kind of had enough of this. How did the medical marijuana find you? Like, at what point did you go, I think this is the direction I want to head in?
Right. Well, interestingly enough, for about 3 years, I personally was taking Ambien because I suffered from insomnia. I have difficulty, shutting my brain down at night. I was always thinking about patients I had seen that day, running through the day in my head, thinking about who I'm seeing tomorrow, what I got coming up, et cetera, et cetera. So it was really difficult for me to shut my brain down. So I was on Ambien for 3 years. I couldn't stand the way I felt with it. When I would wake up in the mornings, I just wanted to get off that drug. So once medical cannabis came into Florida, I went to see my physician and I got my medical cannabis license. So I've been using medical cannabis to go to sleep every evening, and it's really tremendously helped me. I use an actual concentrate that you use under your tongue, and within about 15 minutes it starts taking effect. And the beauty is that I sleep through the night now. I could get a real restful 6 hours of sleep. Before, when I was on the Ambien, I would sometimes wake up at least 2, sometimes 3 times during the evening to go urinate. Now I could sleep a solid 6 hours. I don't even wake up to urinate, but when I wake up, I feel really good. I feel rested, like my body went into good, deep REM sleep. And that's what I'm also seeing now with our cannabis patients, that I have been able to get off their opiates and their benzos as well.
I think everyone has seen in the media the dangers of the opiates. This has really become big news.
It has.
Addictive properties, the unwanted side effects. But can you talk a little bit about the dangers of unwanted side effects or addiction of some of the other mind-altering drugs, be it the Ambiens, the Zolofts, and
Sure.
the SRI drugs?
Sure. So, all these medications, be it the opiates, the benzos, the SSRIs, they all come with warnings, okay? And they all have, sometimes bad side effects that could affect people. Like some of these drugs, for instance, all the SSRIs, they do have a warning on their labeling that they could actually make your depression or anxiety worse. Okay, and oftentimes that happens. And that's why there's so many different of these drugs. And although they're all in the same family, they all might differ maybe from a carbon or a hydrogen bond. The molecular structure for the most part is pretty much the same, but they might have a little, subtle differences. And that's why one medication may work for somebody and for another it doesn't. And that's why...
Or a medication may work for somebody and then it stops and then they change
working.
the cocktail.
That's exactly correct. And that's what usually happens. Oftentimes people are on these drugs maybe for a period of months or years, and then all of a sudden it stops working, or they start having side effects with these medications and they don't like the way they feel. I never really cared the way I feel with Ambien, but I definitely needed my sleep, and but I was happy when I finally got off of it. But yes, these medications, the major effect is that it could worsen your depression, it could increase your anxiety, and here we are trying to cure that, and now we're making it worse with some of these drugs.
Were you addicted to Ambien?
Was I addicted? It's funny. Addiction and dependence are a little bit different. Addiction is when your body is jonesing, when you are craving, when you are having tremors, when you are sweating, when you really, really need that drug, be it alcohol, be it opiates, etc. Dependence is more when, okay, I need this to help me for my condition, but if I didn't have it, I'm not going to be like an alcoholic that needs that alcohol because they're going through those DTs, or somebody that's addicted to opiate or heroin or coke, and they
Because
really,
you said
really
something
need it.
interesting that made me ask the question.
Huh.
You said something like, I don't like the way I felt when I was using Ambien.
Correct.
Right? So that's an example of what I was talking about earlier, is if you don't like the way you feel,
Right.
just stop. However, you struggled with not being able to turn off your brain.
Correct.
It was you going into adrenal overload because your brain was just replaying all the stress of the day.
Completely.
So in that moment, you said, I want relief from this, so you took the medication.
Correct.
Even though the following day, if we were to sit down and have a conversation, I said, do you like the way you feel on Ambien? You'd go, no.
No, exactly.
So it's kind of like you're making a choice. Do I suffer through the mind that doesn't shut up?
Right.
Or do I just drug myself
Right.
and deal with the way I feel tomorrow?
Right.
And I guess that's a part of the element of addiction is people make the choice because they're only thinking of the moment.
Well, that is true. And how many of these people that have died from overdoses, if you could maybe go back in time, maybe they wouldn't have done it.
Can you explain what the differences in the mechanism of action of marijuana versus some of those other medications would be?
Well, I'm not a pharmacologist, but cannabis works completely different than opiates and benzodiazepines. So our body, the brainstem, which is where our spinal cord meets our brain, is loaded with both opiate and benzodiazepine receptors. Our brainstem is what controls our heart rate and our respiratory rate. So that's why people die from these medications when they overdose on them. Now, interestingly enough, we have cannabinoid receptors throughout our entire body, be it our brain, our muscles, our lungs, ovaries, uterus, testicles, large intestine, small intestine, skin, lymphatic system, etc. However, I don't want to get religious or philosophical here in any shape, way, or form, but in the creation of man, however we were created, whatever belief we may have, there are zero cannabinoid receptors in our brainstem. That's why it's impossible to die from a cannabis overdose. The only thing that'll happen is you'll just go into a deep sleep and you'll wake up and you'll be fine. So as far as pharmacology goes, there's no endocannabinoid receptors in our brainstem. And that's why marijuana is such a safe drug in regards to nobody's ever died from a cannabis overdose.
I want to say something. Cannabinoid.
Cannabinoid, yeah?
I just wanted to say it because it sounds like fun to say. Try it.
Cannabinoid.
Cannabinoid.
It's a great
fun,
drug.
Right?
It's a great word. It's a great
cannabinoid.
plant.
So,
yes.
I mean, would you say that
Cannabinoid.
with certainty, marijuana is potentially a superior way to address pain, insomnia? I mean, keep going. Name.
I could
Tell
say
me.
I could say that with 100% certainty.
Uh-huh.
Our answer currently right now to this opiate and benzodiazepine crisis that we are suffering from is medical cannabis. Medical cannabis can help you with anxiety, depression, pain, insomnia, etc. And the reason being that somebody says, oh, well, how could it help for, so many different things? Well, the reason is that because you have cannabinoid receptors throughout your entire body other than the brainstem. And that's why this plant works as well as it does for so many people, for so many different medical conditions.
Now, how do you overcome maybe some challenges that, like, for example, my parents would have this, preconceived notion with regards to marijuana and like, oh, then we're druggies.
Right. Great question. So let me backtrack a little bit. So currently today, the largest percentage of patients that are using cannabis that are coming in for recommendations are patients that are 65 years of age and over. Okay? It's the largest segment of the population that we are seeing that are using cannabis.
All the parents where their kids had to hide their pot, all of the parents
now they're coming in,
right.
Okay? So a lot of these people, frowned upon it tremendously.
Yeah. It makes people jump out of windows.
Completely, absolutely. And you should be in jail. You remember, what was that movie back in the, I think it came out maybe in the 30s or 40s.
Yeah, I remember.
I can't remember the name of it, but it was a movie
Madness.
Reefer Madness. Yes, everybody went mad and crazy because of using cannabis. So, I mean, right there, it was such a negative social stigma, and anybody using cannabis back in the 60s was just a hippie or a drug addict. They just wanted to get high and whatnot. A pothead. But hey, you know what? Times have changed, and here we are, 2020. Cannabis is the new normal, okay? And it is our answer to this crisis that we have. So it's all about educating patients. The Latin definition of physician is teacher. So whenever I see a patient and I'm spending time with them, I could do a physical exam in no time. But the quality part of the exam comes not because of the exam that I did, but me sitting there and speaking with the patient one-on-one and not looking at the computer, not looking at my watch and worrying that I have 20 other patients outside the waiting room waiting for me. I really take my time with my patients. So it's all about proper patient education, because education is empowering. So when you empower these patients with proper knowledge and education, now they're saying, oh, wow. So that negative stigma of what cannabis used to be has changed dramatically. And what I've seen with these elderly patients is they're dying to get off these medications they're on that they don't feel any better with.
They're experiencing the side effects.
Some of them are taking 2 or 3 different SSRIs at the same time with another benzo. I can't tell you how many patients I see that take Ambien at night and take Xanax during the day.
Sure.
Right.
I mean, it's crazy. Crazy. Mm-hmm. So it's tremendous when you see these elderly patients.
I'm going to interrupt you. You said it's crazy.
Right.
But where do they get the drugs from? From their doctor.
From their doctor,
right.
Absolutely.
So that's what's crazy.
Right.
Honestly, what's crazy is the whole medical system.
Right. Listen, that's a whole different topic of discussion, be it big pharma and insurance companies and whatnot, and where medicine has gone and where it's gone and where it's going.
But are you comfortable with doctors blaming the patients, or shouldn't they be complicit in this? Not to say that people need to be responsible, but isn't there some finger that needs to be pointed at the medical system?
Right. Well, listen, obviously, we as physicians, we created this opiate crisis for prescribing
you
drugs.
Said the other day, and I don't think we were being recorded, that the drug rep came in selling you, was it oxycodone the first time?
Oxycodone, yeah, absolutely. Yeah. And I remember clearly, this was maybe about, I think maybe 20 years ago, 19 years ago when it first came out, specifically detailing us and telling us, hey, this is not habit forming. This is not a habit forming drug. And obviously, look at what has happened.
And he wasn't lying.
No, this is what they were instructed. He believed that this is what they were telling them, and so forth. So here we thought, here's a great drug where people can't get hooked on. They're not going to die from it.
Well, I'll tell you why I'm coming back to this idea of the medical system or the doctors being complicit in this. Because for a long time, when I would work with people who were in their 50s, 60s, 70s, they have this great reverence for what they call the old-time family doctor. Have you heard that?
Yes,
where they
absolutely.
go, the doctor was my doctor and my daughter's doctor, and would come to the house when we were sick. And doctors aren't like that anymore. Yet, because they have that memory, they still at some level believe the doctor's always right, and if the doctor told me I should do this, I should do it.
Right.
So there's got to be somebody who's saying, but if your doctor's giving you Ambien to sleep and Xanax during the day, maybe it's not the right thing for you.
Exactly. Well, I'm that person. So when I see that, I do tell patients that. When I was practicing conventional medicine and I would get patients coming in from other physicians or new patients and I see the medications they're on, I'm thinking, oh my God, no wonder you feel the way you do. It's crazy, this cocktail that you're taking.
And do you ever get pushback from other practitioners?
No, I don't. I've never had anybody call me and say, hey, I can't believe you took my patient off this drug or whatnot. No, that hasn't happened.
Yeah.
At least in my experience practicing medicine.
Because they know. The doctors who are prescribing the drugs
listen,
know.
they know. I mean, listen.
The justification is I'm giving the patient what the patient is asking for.
Right. And that's not practicing proper medicine. Because oftentimes the patient doesn't know.
By
That's
the
what they're
time
coming
the
to you for,
patient
the expert.
presents to you, are they often the kind of person who says, I've tried everything?
Some patients.
Like, are you the last?
No, I wouldn't say I'm the last one. Not before when I was practicing conventional medicine, but now that I'm strictly doing medical cannabis, maybe trending more in that direction, in the sense that these patients are coming to see me now because they want to get off these drugs.
Right. They're almost desperate.
They're almost desperate because conventional pharmaceutical drugs have not helped them.
Failed them.
Have failed them, exactly.
And so because of that, are they more open?
Completely open. I mean, listen, just the fact that they're coming in shows how open-minded they are to this.
Right.
You know, I asked you a question the other day, and it made me laugh, but really it was a good answer you gave me. I asked who would be more educated in the prescription of medical marijuana, the conventional doctor,
right,
or Snoop Dogg and Seth Rogen, and your answer was
Snoop Dogg and Seth Rogen.
Yeah,
absolutely.
Yeah.
Yeah.
So it's an entirely new perspective on a very old drug.
That is correct. This plant has been around longer than man has. Okay, and again, unfortunately, it got the bad rap that it did. In this country, we are so far behind the times in true pharmaceutical studies. Okay, Israel is the leader in cannabis studies. They are the forefront, and they've been doing it for decades. So thank God they've been doing it because we are so far behind the times.
In specific indications?
Israel?
Yeah.
Like
specific diseases?
Yes. Well, what they're doing is they've been doing research on cannabis now for decades. But Israel, what they're doing now is they're actually trying to cross different strains with different cannabinoid profiles and different terpenes where they could hopefully manage and treat more specific disease, such as Parkinson's or Lou Gehrig's or multiple sclerosis. And they're really homing in on saying, hey, listen, if we were to cross these and these strains and then recross them, and now we have this high terpene profile with these cannabinoids, it could really help this disease. So that's where they're trending.
Seeing what you've seen and knowing what you know, I would guess that you believe that we haven't even scratched the surface in what
no, absolutely
cannabis
not.
products can do for people.
Without a doubt. This is
and
like
what about
the future
the
of medicine.
anti-inflammatory effects of CBD and or THC?
Well, studies have shown that they have stronger effects than actual prednisone.
Yeah.
That they're stronger than cortisone, prednisone, absolutely.
We did a podcast kind of
deleterious
discussing
effects.
Really that inflammation is the root cause of just about every disease.
Without a doubt.
If we can bring down inflammation,
If we could bring down inflammation,
it's a game changer.
Without a doubt, absolutely.
All right, so I could think back to my high school or junior high school. They call middle school now.
Right.
I could tell you who could roll the best joint with paper.
There you go.
I could tell you who would get the best pot. I could picture the specific pot heads who were always, they knew the spot to go light up a joint. So we think of how it's changed. My date to the Who concert in 1976 was the hottest girl in my high school.
You have pictures?
I don't. We didn't have like phones then to just take pictures.
Right, there you go.
But I could not believe that she was going out with me because I got tickets to the Who.
Right.
And before the Who concert, she said, do you want to smoke some of this? And I said, what is it? And she goes, angel dust. And I said, no, I don't think so. She goes, no, it's really good. No. She goes, I'm going to smoke it. Do you mind? I said, no, I don't mind. So she smoked a joint and we went to the concert. It was amazing. And at a certain point, she's like grabbing my hand and hugging me. I'm going, this is the greatest night of my life.
There you go.
I'm 16 years old. I got the hottest girl in the high school. And then at the end of the concert, she grabs my hand and she's rushing through the crowd. And I thought, this is really good. She can't wait to get home now.
Right.
And then all of a sudden the crowd scatters and she's throwing up right in the middle of Madison Square Garden. And the whole ride home, she's throwing up. And that changed my perception of her, but also
the whole evening.
Yeah, but I'm asking that because I think of the potheads who would sit and smoke every single day. And by the way,
Right.
some of them did well in school and developed careers and are doing really well.
Without a doubt.
And then the girl who smoked the angel dust and got really sick. So there was no control. In other words, you don't know what you're buying. You don't know what you're smoking.
Well, that's
if a hot
exactly
girl
it.
hands you a joint,
Right.
you'd go, okay, I want to try some of this.
Sure.
So is it a different world because of that? In other words, we think back to a time where everybody thought pot was bad. Your parents didn't want you smoking pot.
Right.
Now those same parents are
Are the ones
older
coming in for
and
it.
they're the ones coming in. But having seen negative things happen,
Mm-hmm.
is it safer now? Or should people legitimately be afraid? Like, hey, I remember what happened to me at the Who concert in 1976.
Right. Well, again, back then, there were no medical cannabis dispensaries. Okay? It was completely illegal. Now we have more than half the country where medicinal marijuana is legal. We have so many states that have gone recreational. It's only a matter of time before the entire country, or the overwhelming majority of the country becomes medicinally legal, as well as possibly in the future recreationally. But what happens is this: all these people that, like for instance, last year became really, really ill from the vaping crisis with the concentrates that they were using. All those things were bought over the counter. None of it was bought at the dispensary. So the products that people are buying at dispensaries are as safe as if you were buying a medication from behind the counter. Now, by that I mean all medicines have side effects.
Sure.
But it's not going to be tainted with LSD, et cetera, formaldehyde, ecstasy, etc. So these people that had died and gotten severely, severely ill, it was because illegal manufacturers were making these concentrates, and they were putting vitamin D vitamin E.
Yeah.
I'm sorry, vitamin E in the cocktail. And that's what created all that lung disease, and people did die
Which
from that.
became toxic when heated.
Without a doubt. So what happened after that was, all of a sudden now there was a surge in people thinking, oh my God, I need to get my medical cannabis license.
Yeah.
Okay. So what I tell patients all the time is, this is safe. This is inspected by the Department of Agriculture, as well as third-party independent lab testing. So that what you're buying, it's legitimate and it contains what it says it contains. So in the dispensaries, they all have these barcodes. So depending on what you're buying, you could actually go into onto the computer, onto your phone and whatnot. You go into that particular dispensary with that box, if you will, the
QR.
The QR, exactly. And you look it up and it tells you everything that's in that species of plant that you just bought. And that's how it's become truly medicinal, because now we could home in on, okay, this one has this cannabinoid profile, this one has these terpenes profile, and it's been tested and it's safe, and you're not going to die from it.
And
you're
down
not gonna,
that same line, like what about, you can go anywhere now and everything says CBD on it. Like, is that real?
Well, good question. So last year, an article came out in both New England Journal of Medicine and JAMA, the Journal of the American Medical Association, that they tested 70 to 75 different random products.
CBD products
that were over the counter. The overwhelming majority of them contained 0 CBD. The ones that did have some maybe had a fraction of what they were touting that it had. And the reason being is that anything that you buy over the counter, be it a vitamin, be it CBD, none of it is regulated by the Food and Drug Administration. So if you read the fine print on these bottles, it clearly tells you this is not meant to diagnose, treat, etc. So it's like you're just wasting your money. You're buying garbage. And in some of these things, it actually had some toxic substances mixed into it as well. So again, when you're buying from a dispensary, you're getting real cannabis, you're getting real CBD. You don't have to be worried about it containing something harmful and dangerous that you could possibly die from.
Let me ask you something else. There are people who I know who say they get paranoid when they smoke pot.
Uh-huh.
Is it the strain? Is it the person? Is it the wrong strain for the wrong person? And can you control that? Like, if somebody tells you that,
Correct.
do you approach it differently than you would if they didn't?
Without a doubt. So, to your question, all of the above are true. All of the above are correct. Again, depending on your genetic makeup, for some individuals, cannabis can make you more paranoid. Okay? But again, it oftentimes depends on the patient as well as the strain of cannabis that they were using. So, depending on the terpene profile, and terpenes are what give plants, flowers, etc., their smell. So, for instance, roses, tulips, gardenias, basil, rosemary, all those smells that you could think, cilantro, we were talking about cilantro earlier. So all those different smells that these plants have, those are the terpenes. So depending on the terpene profile, that determines whether a strain of cannabis is more of an indica or of a sativa. So what's an indica? An indica strain has different terpenes, which when used will be more sedating. They help with pain, they help with anxiety, etc. So you want to use indica strains during the evening, at night. One of the sayings for indica is in the couch, because oftentimes it's just, that's it. You're in the couch, you're done.
Good night.
Good night. You just relax and chill out. Whereas the sativas are more uplifting. They contain the other spectrum of terpenes. And those are much more uplifting. The sativas, you could use them during the day. Oftentimes they do not cause, drowsiness.
Some people take Ambien to sleep at night and Xanax during the day.
Right.
Would some people do that with their marijuana?
Yes, absolutely. So I have patients that, especially the patients like, for instance, with Parkinson's or ulcerative colitis, Crohn's, etc., that need to be medicated throughout the day. Because if you're using cannabis inhalationally, usually within about 3 hours the effect wears off, and you got to use again, possibly if you need it. Whereas with oral cannabis that you're ingesting, it takes about an hour and a half usually for it to kick in, but you may have psychoactivity for up to 8-10 hours sometimes. So it's extremely different how the drug works if you're using it inhalationally or if you're ingesting it.
Weren't you saying the other day that there's a way to kind of get the effect to wear off?
Yes. So what we were talking about the other day is that a lot of people don't know that if you were to get too much psychoactivity from a strain of cannabis, if you were to get real high, and now you start getting paranoid and you feel awful, if you were to vape pure CBD, and there are dispensaries that do carry pure CBD, it actually will bring your high down, because CBD has a stronger affinity to receptors than THC does. So it'll bring your high down quite effectively.
So if a patient presents to you and says, I'm interested in trying medical marijuana, but I don't really enjoy the high effect,
Correct.
You would give them something that has a higher concentration of CBD versus THC? Or?
Correct. Well, that is absolutely correct. So what's interesting is that we now know that CBD works better with THC, and THC works better with CBD. So the sum of all the parts work better together than independently. It's called the ensemble effect or the entourage effect. So in my cannabis practice, oftentimes I see patients that do not want to get high, okay? And I respect that. Not everybody wants to have any psychoactivity. So they do have products, they have concentrates and vapes and tinctures that are a combination of THC and CBD. And in here in Florida, CBD goes first, then THC. So if you look at something that has a 1-to-1 ratio, it's going to be 1-to-1 of CBD to THC, so like 50-50. But so if you were to use a ratio of 1-to-1, the psychoactivity that somebody may get from that would be like maybe drinking maybe 2 glasses of wine.
Okay.
And that psychoactivity may last maybe, 2 to 3 hours. If you start using a concentrate that has a ratio greater than or equal to 5 to 1, you'll experience no psychoactivity. Okay, so that's what I'm using on these patients.
And would they still experience the same benefits?
They would still experience the same benefits, even with that little bit of THC, because that will enhance the CBD. Now, for some of these patients that need real high dose of CBD, be it patients with rheumatoid arthritis, multiple sclerosis, they sell concentrates that are 10 to 1, 15 to 1, 20 to 1, 25 to 1, 30 to 1. And those patients do really well with that really high CBD concentration for anxiety, inflammation, pain.
And have you seen any patients in your practice where you've done before and after blood work and their inflammatory responses are coming down? Like, say, for example, a rheumatoid.
You know what?
Like
That's
their SED rate comes down.
That's a great question. So, no, I have not. Because in my medical practice, obviously, we were doing blood work all the time on these patients. But in my cannabis practice, we don't draw any blood there. We're not doing that type of stuff. But that's something that
Kristen, I love this. I love this idea.
Right. But you know what? That's, to be honest with you, that's a brilliant idea. It would be interesting to see, hey, what happens here at baseline before you start using it, and then maybe we could see, your SED rate and different inflammatory markers. Are they down?
And have they reported anecdotal responses? Like, okay, I'm feeling better. I'm getting off of my Humira.
Yes, that I get all the time. I haven't had anybody quite come off their Humira yet, but I have had countless patients that have come off their opiates, their benzodiazepines, their SSRIs, or before if they were on an SSRI and they were taking maybe 40 milligrams of it, now maybe they're down to 10. And maybe next time I see them, they'll tell me, hey, I stopped it. I don't need it anymore.
Amazing.
So I'm seeing that all the time. And that's great. That warms your heart when those patients come in, especially the elderly patients. I had a lady the other day, an 82-year-old patient who had never used cannabis in her life. I got her started on it about 7 months ago. And I just saw her this past Monday. And she was taking opiates. She has rheumatoid arthritis, and she was on a benzo to help her with her anxiety and help her sleep. And I met her 7 months ago, and lo and behold, here she is. And she saw all those drugs, and the only thing she's using is cannabis. And it's when they tell you this, it's almost like shocking. It's like, wow.
Is there anybody that's contraindicated?
Contraindicated? Well, in the state of Florida, obviously you have to meet qualifying conditions. So if you have one of the enumerated conditions or a condition similar to the enumerated condition, you qualify. So you have to have criteria to get a recommendation from a physician. So anybody that just comes in and says, "Oh, I want cannabis," it doesn't work that way. But I haven't come across a patient yet that I would say that cannabis wouldn't be the drug for you. But there's different types of cannabis, like we were talking about the strains, that somebody who is very excitable or has sometimes some paranoia. The last thing that you would want to do is put this individual on a sativa, because that has a greater chance of making them worse than maybe an indica strain. So it all depends. But what we tell all the patients is, all of us as cannabis physicians, that you got to start slow and you got to go low. You can always titrate up, but once it's in you, you don't want to have a bad experience and then you stop using this medicine because of the wrong reasons.
Right.
And sometimes I do have patients like that. They'll call me up, they say, hey, this didn't work, and and then once you start talking to them, you realize why it didn't work, that maybe they didn't use it correctly, they didn't follow instruction, or they went to change dosing, strain. They didn't listen to what I was telling them, and because this was on sale, they bought that, and so.
And when you see them, you actually write the prescription for what you want them to get at the dispensary.
Well, it's not a prescription; it's a recommendation.
Okay,
so it's not an RX like a typical prescription pad. But based upon their symptomatology and what I'm treating them for, is I will definitely give them a recommendation with different strains of cannabis that the dispensaries have, that oftentimes I have used myself, or I know patients that have used them, and the benefits that they have. So yes, I definitely tell patients when I see them what could help you. And again, it's all about going slow and about going low, because you can always titrate up.
Why isn't this at every doctor's office yet?
That's a good question. We have 22 million Floridians, and we only have about a little, I think it's the latest was, I think, about 2,500 as of today's date, physicians in the state of Florida that are doing recommendations. So a lot of doctors don't want to do it. A lot of doctors, fear that because it's still federally illegal, that it's still a Class 1 controlled substance. And this is where all politics and pharma and government come into play, and that's a different crazy discussion. But yeah, interesting times. Very interesting times. But yes, I do like to give patients specific recommendations on different strains of cannabis and what to definitely avoid. Yeah.
You seem to be going down a road, so I want to back it up if you don't mind.
No, please.
But Kristen, what you said before, why don't we do labs? And you said, well, we don't do labs for this, because really what you're looking at is, do you have pain anymore? No, I don't have pain anymore. Great, you're off your drugs. Right? That's kind of the victory.
Right.
But we're dealing with people who have chronic disease.
Right.
And commonly we see people with type 2 diabetes, and we see people with hypothyroidism and weight loss resistance and hypertension and metabolic syndrome. And all of these at their root have inflammation.
It's all inflammatory.
One of the markers that we've looked at is C-reactive protein.
Correct.
And not HS-CRP, not specific, but just looking at systemic CRP, here's what I know. If somebody has, I'm just going to pick random numbers, CRP of 2.9, and then 8 weeks later it's 0.2, we have reversed their inflammation. We don't know where. We don't know if it was brain, gut, a combination of things, if they had some infection, we don't know. But we've reversed their inflammation. I would love to do some kind of lab work and do a study where we work with some of your patients, some of your new patients.
Right.
And let's compare the people who use marijuana versus the ones who don't.
That'd
because
be very
I would love to be, if in fact, those who use marijuana have a greater reduction in C-reactive protein, this probably should be a part of the protocol.
When you guys see your clients here at Biohackers, are you guys doing baseline labs on them at all, or?
The personal trainers, depending on how the person connects with them, meaning there's a low-level program and then there's a more comprehensive program. The more comprehensive program, we're looking at labs.
Gotcha.
So not everybody does, but we certainly can implement a group of people getting some labs before and after.
Right. Well, studies have shown, for instance, in talking about diabetes and inflammation and whatnot, that studies are showing that every single diabetic should be using cannabis, high CBD. And it's been shown to lower your hemoglobin A1C. It doesn't mean I'm going to tell you to stop your insulin. Doesn't mean I'm going to tell you to stop your other metformin, et cetera, but as an adjunct, proper diet, exercise, weight loss. I mean, listen, for the most part, nobody should be type 2 diabetic. Type 2 diabetes is something that we created from
Tell me if
obesity,
you're okay with this statement.
Morbid obesity, etc.
I believe that 100% of the cases of type 2 diabetes are self-induced and reversible. That doesn't mean people did it on purpose.
Right, of course.
And it's hard for people to accept that because they think we're blaming them.
Right. And when I talk to patients, it's... First of all, I treat all my patients like my family. Okay? Every patient,
How do you treat your family?
I treat them beautifully.
Oh, okay, good. Just making sure.
Now, if you ask my wife and my kids that, they may argue with that, but I think I'm pretty good. No, first of all, you should always treat your patients like loved ones. But yeah, I agree with you. So it's not blaming the patient or shaming them. Again, before we were talking about the commercials on your phone, etc., and I'm going to feel better with this and that, and it's no different than what the food industry has done. Supersize this, supersize that. It's cheaper to buy an extra large soda at a 7-Eleven than it is the smaller one. Or
I don't know. Honestly, I haven't bought
I
it.
was going to say, I've never bought one of those.
I'm not in 7-Eleven, but or any of those places, to be quite honest with you. But from what I hear,
Right.
or for a nickel more, you
Word
could
on the street,
supersize
yeah.
it. So that's what has happened. So and in this day and age we live in, listen, the easiest thing in the world is to do nothing. And then the next question is, to treat what you want to treat, could I have a pill for it? Is there a pill for that? Mm-hmm. So again, it's all about diet and exercising, and it takes the proper behavior to stimulate that type of action. And that's where we as physicians come into play to educate our patients, put them on a proper program, no different than what you guys are doing.
Did you have a ponytail when I met you?
Yes.
You did?
I did, yeah.
Okay.
I had hair back in the day.
So I'm thinking back when I first met you, and I spoke about this in another conversation, but you just didn't look like a doctor.
No.
But you are in a very, very good one.
Thank you.
But you were always very into fitness, and I believe
Yes.
martial arts at
Martial
some
arts,
level.
yep.
So combining those two makes you an exception. That doesn't mean doctors don't exercise.
Right.
But having met with and befriended and spoken in front of many doctors, they don't integrate it into their life at a level that it just becomes what they do.
Correct.
You did.
I did.
And were those concurrent? Did the fitness thing come first and then you wanted to be a doctor, or you wanted to be a doctor when you were 5 and you were always into fitness?
Well, I did want to become a physician since I was very young. At 5 years of age, I kind of...
You knew.
Announced
I kind of knew.
Yeah.
I announced it. Yeah, I pretty much knew. But, I was always active as a kid. I mean, I certainly had, as an adolescent,
By the way,
my
I was going to
chubby
be a New
stages.
York Knick when I was 5 years
There you
old.
go.
Yes.
Nice. What happened?
I found later that I'm white and I'm short.
There you go.
That didn't work out.
There you go. If you were a little bit shorter, maybe you could have been a jockey.
Had no interest in that. But if I wake up tomorrow and I'm 7 feet tall, I'm still going for the Knicks.
There you go.
Anyway, I interrupted you guys.
No worries. So when I was an adolescent, I was a chubby kid.
Oh, you were?
I was a little bit chubby as an
Okay.
adolescent, absolutely. But then when I turned 12 or 13 and started going girl crazy, that's when everything...
Chicks like muscle.
I guess. I don't know.
Okay. Chicks like abs.
I don't know.
You do know. Don't tell me you don't know.
I think some do, some don't. I mean, there's a degree of, the entire spectrum from this to that. Be it the one that doesn't lift any weights to obviously the
Kristen,
pro
Chicks
bodybuilder.
like abs.
So,
All I can think of is a Shania Twain song. That don't impress me much. So you got a fancy body.
Yeah, so, I mean, listen, a fancy body only goes so long. If
Yeah.
there's nothing intellectually there.
But I really wonder,
Right.
and the reason I'm thinking about fitness and doctor together is I wonder if that's what led you here. In other words,
Well-
there's something holistic, there's something natural. I don't remember who said it, but I heard somebody talking about alternative medicine.
Right.
And he broke down the word alternative, and it says
Alternative.
native.
Correct.
So alternative suggests we're doing something other than that which is natural.
Right.
But the truth is, conventional medicine is
Exactly.
truly alternative, right? So you kind of went to native.
Correct.
Right?
I like that.
And I wonder if that's just kind of inherent in your upbringing as you understood fitness and nutrition and how important it was to feel good.
Right. Well, listen, I've been a physical fitness buff my entire life for the most part. And as a physician, you have to be the complete part. If I was obese, morbidly obese, how am I going to tell my patients you need to diet, exercise, and lose weight?
But you've met doctors who are morbidly obese, haven't you?
I have. And oftentimes those doctors, in my experience, don't tell their patients anything about obesity, dieting, and exercising and losing weight.
Well, but how many traditional practitioners do? How often is that happening when you have 8 minutes?
It's rough. It's rough.
I knew
It's rough.
a group, an endocrinology group that I worked with, and most of their practice was diabetes. And they understood that people just want the drug and that the drug is not going to fix anything. So they required, in order for somebody to leave with a prescription, that they would watch a video. And it was a really good video, and they had a room with the video playing all day long. It was Sanjay Gupta and some other people talking about how to eat healthfully. And I said, what percentage of the people who you prescribe drugs for watch the video? And they said, we try to get all of them. And I said, what percentage do you think changed their lives as a result? He said, almost none, maybe 5%. They just do it because we ask them to before they get the drug. So even if the doctors do kind of offer that advice, they don't do it in a way that the patient can internalize it. And that's why I'm saying for you, it's so integrated into what you do.
Exactly.
That I would guess you can give your patients genuine advice, not just here's the sheet of foods not to eat if your blood sugar's high.
Exactly. That's exactly it. So, listen, the best teacher is experience, and there's nothing better than having experienced it yourself, being physically fit, taking care of yourself, eating properly, and then passing that education on to your patients.
And cannabinoids.
And cannabinoids, absolutely, without a doubt.
Yeah.
And cannabinoids are huge.
All right, so here's what I'm getting out of today.
Please.
I need to go on Facebook and look up that hottest girl in my high school and see how she turned out.
That would be scary. You never know.
Yeah, probably better if I don't.
I would stick with the memory as opposed to the reality. Yeah.
Listen, I told you we're going to do a lot of things together. We are. As a matter of fact, right before we did this podcast, we were in our facility, and a woman came in, and we were talking to her about getting started on our reboot program.
Right.
And you walked in.
Yeah, no coincidence.
Yeah, and I said, you know what? You have to talk to him. And before you know it, she's coming to you, and her daughter has an issue. And I just think we're going to do so much of that because we're so very aligned.
Without a doubt. And it's all really about helping individuals. And, listen, we're all one in what we do for somebody else. We're actually doing it for ourselves as well. And if we could all think that way, it would be a different world.
So I oftentimes tell Phil that every morning I wake up and I look in the mirror and I say, who am I going to help today?
Right.
And I get the feeling you do the same.
It's just habit. Mm-hmm. It's just habit. And there's no greater satisfaction than somebody telling you, thank you for helping me. Mm-hmm. You helped cured me. That's the greatest satisfaction. That's priceless. That's priceless.
There was a workshop that I was invited to, and it was about using authenticity. It was a marketing workshop.
Authenticity.
Using authenticity. And what struck me was the first assignment for the workshop was reinvent yourself. What would you like to be? And I was like, wait a minute. This is the opposite of authenticity. But sitting here in this room, this is authenticity. I mean, all of us are driven by a mission, a passion.
Of course.
We couldn't do something in which we didn't help people. We'd feel like we're missing out.
Without a doubt.
And that's the reason we're sitting here talking. I mean, whether it's 5 people who watch this or 5 million people who watch this, somebody's going to hear something you say and get off of their drugs.
Correct.
And make the right choice. And that's why we're sitting here right now.
Yeah, I hope so. All right. But, I think we all reinvent ourselves. I can't tell you how many times in my career I've reinvented myself and probably will continue to do so.
But I would say
reinvention is good.
Reinvention is good if it comes from within you.
It has to come from your heart.
Not where somebody gives you a pen and says,
No.
decide what you want people to think of you.
No. That fails.
We live in a world right now where people do that. Like on Facebook and all of the social media, they kind of reinvent themselves into something they're not.
Right.
But my point is, I think what we're doing is working because we're genuine and passionate. And although you've evolved and you may have reinvented yourself, inside you're the exact same person who was helping your first patient.
That part of that is completely true. Absolutely.
All right. So let's go get high. Okay?
Legally.
Of course. The doctor said.
The doctor's
legally,
in.
Yeah.
Legally.
The doctor said, let's get wasted. What are we going to do?
I didn't say that. I said, let's get medically treated.
Oh, okay. I thought you said wasted.
Could I plug the practice?
I think you
Please.
should.
All right. The name of the practice, everybody, is High Level Health. Our website is high, H-I-G-H, level, L-E-V-E-L, health, HEALTHFL.com. And our phone number, I'm looking at my new number here on our new cards, 954-240-6706. Give us a call, and we'll be more than happy to help you guys.
When they give you a call, what should they expect? Like, do they make an appointment? Is there a free consultation? Do they come in for an exam? Do you check their prostate? I mean, they want to know this beforehand.
All great questions. So usually oftentimes when they call, they want to know if we're the ones that are selling the cannabis.
Right.
So we say, no. We are a medical practice that determines whether you qualify in the state of Florida for a recommendation to go into the dispensary and purchase cannabis products. So once they know who we are, if they are exactly who we need, who they need, then we schedule them. We send them electronically papers and forms for them to fill out. That way, when they come to the office, everything's filled out. It's all done electronically. It's very streamlined. And that way, that part of it is done. So that way, it gives me much, much more time to spend with the patient one-on-one and really educating them. Because it doesn't take me long to enter everything in the computer as well as into the medical marijuana use registry. What's time-consuming is properly educating the patient. And every patient that walks out of my office will be properly educated on proper cannabis use.
So let's wrap it up with this. The leading experts. Number 1, Seth Rogen. Number 2, Snoop Dogg. Number 3, Dr. Carlos Levy.
I hope so.
And if you can't reach 1 or 2, go to 3.
If Seth Rogen or Snoop Dogg want to be a guest, I'm going to allow it.
There you go.
They can come on.
I would love to see them in here with
All
you.
right.
This room will be filled with smoke.
If anyone watching knows them, let them know they're
invited. Let them know,
invited.
please. Thank you.
We'll be back with Seth Rogen and Snoop Dogg very soon.
Have me on that day, please.
Thanks for joining us. Bye-bye, everybody.